Well, thanks for that kind introduction. Good afternoon, everyone. It's great to be at this session on the role of positive masculinities in addressing gender inequality. And what a beautiful room, what a beautiful audience. It's great to be with you this afternoon. As our MC mentioned, my name is Terry Duguid. I am the Member of Parliament for Winnipeg South. I'm also the Parliamentary Secretary to the Minister for the Status of Women, and I have the great privilege of working with the Honourable Marion Monsef to advance our government's ambitious agenda to advance gender equality. And like many of you in the audience, Mariam is a young, dynamic leader that is changing the conversation in our country, and in fact, I think she's changing the country. And we are working very hard on a gender-based violence strategy, initiatives that close the wage gap and achieve pay equity, as well as important social policies such as childcare and affordable housing that are critical to assisting women getting into the workforce. I am the first man to be appointed as the Parliamentary Secretary to the Minister for the Status of Women. The Prime Minister asked me to serve in this role that has traditionally gone to a woman, and I think he was sending a message through my appointment that women's issues are not just women's issues, they are societal issues, and men and boys, women and girls, we all have to put our shoulder to the wheel to advance equality in this country. We have some terrific panelists with us this afternoon that will examine the role of men and boys as part of the solution in addressing gender inequality, including gender-based violence. The young leaders with us will talk to us about gender equality and violence in their own countries and communities, and will highlight challenges and best practices in making men and boys champions of women's and girls' issues that, as I said before, are everyone's issues. I'm going to invite our panelists up one by one. We have with us Austin Henderson, Plan International Canada Youth Advisory Council member. Come on up, Austin. And we have Patrick Musije. He is the PMNCH Adolescent and Youth Constituency Organizer from Uganda, and he's going to tell us what those initials mean, because I'm not quite sure. Cassandra Morris, Health Bridge Foundation of Canada, and Joanna Paulus Yimbasalu, Women Deliver Young Leaders of Cameroon. And just a word about the format this afternoon. I'm going to ask each of our panelists to introduce themselves and give a short description of their work, 3 to 4 minutes. I am going to hold up the red card at about the 3-minute mark and ask them to finish their thought. We're going to start with Austin, then Patrick, Cassandra, and Joanna. After that, I'll have a series of questions as the moderator to pose to them for about 15 minutes, and then it'll be over to you. So you can be thinking of things that you want to ask our esteemed panelists from the discussion that we're going to have in just a moment. So we are going to start with Austin.
Hi, everyone. Thank you again for taking your time to attend this important conference today. My name is Austin Henderson, and I have the incredible opportunity of being a member of Plan International Canada's Youth Advisory Council, as well as one of their maternal, newborn, child health youth advocates. In this capacity, I have the honor of embodying Plan International's mission to help improve the lives of women and girls, particularly children, around the world. My birth story begins in a small town in New Brunswick, where I was born and raised. With a population of just over 2,000, it isn't necessarily the most socially just place in the world. As I grew up, I had numerous opportunities to see different parts of the world, hear different stories, meet different people, and experience different cultures. It was because of this, being exposed to the world's greater issues, that I became interested in recognizing my privilege to speak with my female counterparts to improve gender inequality. Sexual reproductive health rights, in particular, may be seen as something that we don't have to worry about in Canada. But they have something much more than just personal value. To get straight to the issue at hand, complications from childbirth and pregnancy itself are the second leading cause of death amongst girls aged 15 to 19. Every single year, 2.7 million babies die. That is the equivalent to 9,000 times the amount of people sitting in this room today. These issues surrounding childbirth are directly related to gender inequality and are only one part of the issue. Toxic masculinities and harmful gender roles are a big part of the problem. As a result, positive masculinities and engaging men and boys in this work is a huge and fundamental part of the solution. It may be 2017, but Canada is still affected by gender inequality, even in terms of SR/HR issues. Many Canadians are amongst the 2 billion women around the world that are of reproductive age and therefore menstruate. If we take, for instance, my male friends, menstruation is something that they do not talk about because in Canada, there is a taboo around this natural issue, and it's something else that marginalizes women. Plan International Canada works both internationally to advance gender inequality and SR/HR, while also raising awareness right here in Canada. This is crucial in the fight to achieve gender equality, because in a country like Canada that hasn't achieved SDG number 5, it means that we have a lot of work to do. My involvement with Plan International Canada is important because it shows the effectiveness of empowering youth. In the next few months, youth from this organization will be launching an initiative called Youth for Gender Equality, a series of dialogues nationwide, spearheaded by youth for youth, in order to complete a compilation of recommendations to address gender equality here in Canada, in hopes that this will spread likewise movements across the globe. Likewise, their Maternal Newborn Child Health Youth Advocates program has engaged youth from coast to coast to discuss issues of maternal newborn child health. I am proud to say that some of these advocates are sitting here in this room today, as well as watching online. The most important thing to do in order to target masculinities in relation to these SR/HR issues and gender inequality is to ensure that men are not only engaged, but rather equal partners. Nothing can be decided on behalf of women, but the issues that they face cannot be solved without targeting one of the biggest issues and the biggest causes of the problem, which is gender inequality that is perpetuated by toxic masculinities. But in order to be equal partners, men need to step back and recognize their privilege in order to share the space with their female counterparts. Around the world, Canada is seen as a trailblazer. By engaging in this discussion here, our passion disseminates. And men in this room, I call on you in joining me to recognizing our privilege and to take action, because we have an awful lot of work to do with our female counterparts. By engaging all genders in maternal newborn child health care, sexual reproductive health rights, and all issues that influence gender inequality, we can help change the narrative surrounding many birth stories, but we can also help change the narrative and the story that surrounds gender inequality. Thank you, and I look forward to your questions.
Hear it for Austin. Thanks, Austin, and now over to Patrick.
Thank you. Thank you very much. My name is Patrick. I'm WCJ, and I'm from Uganda. I work with the Uganda Youth and Adolescent Health Forum. I'm the founder. And I'm also, I have the pleasure to be part of the Adolescent and Youth constituency of PMNCH as an alternate board member representing the Adolescent and Youth constituency. I have grown up in a society where violence and gender inequality is real. And I've seen it in my family when I was young, even now, when I'm old, because I have a sister, my personal sister who I follow, who has several times been beaten by the husband and denied an opportunity to find a job simply because the husband wants her to stay at home. And that has been a genesis of violence in the family. And this troubles me, you know, as a brother to this young lady. And even in the past, I have seen this in my family. And I have also worked, and I work with so many adolescent girls and young men who undergo the same problems and the same issues. And to me, this has been the motivation to come out and, you know, do something. Because when we keep quiet about things that matter, then we are opening a way to not address them. And so equally so, gender inequality and gender-based violence happen every time we don't talk about it. if we keep it private, if we keep it a private issue and we don't openly talk about it in community and in society. And this is what is happening. I work with a couple of adolescent boys and adolescent girls. And oftentimes we've engaged and brought them together, and we've asked them, what do they understand by masculinity or manhood? Most of them tell us that we achieve manhood when we dominate and, express dominion or power over the female gender. That is what society teaches them. So if we do not, go to them and teach them the positive masculinity and, what to expect, what positive masculinity is, how to define roles, behavior, responsibilities positively, then society is going to teach them the negative masculinity. And that perpetuates violence, like most of us know. So boys and men are concerned when women suffer from gender inequality. But unfortunately, most of them cannot define inequality, nor can they define GBV. And in most cases, gender inequality happens because people, especially men, choose to exercise power and control over the female gender, like I earlier told you. In our society, men and women are not yet equal, and more value is given to men than to women. And as long as there is that imbalance of power between men and women, GBV and gender inequality will continue to happen. Usually this power is abused to discriminate and violate the rights of women and girls through sexual and gender-based violence and other forms of inequality. Many young men and boys believe that manhood is about dominating over the female gender. But if targeted and supported, young men like me, like these guys you see over here, have the ability and potential to use their power and opportunities to advocate for promotion and respect of women's rights. And as I wind up also, we must understand that failing to realize the fact that we have denied women and girls of their reproductive rights has created a gap, a policy gap, that negative masculinity is using. For example, if we say adolescent girls who are sexually active cannot use contraceptives or cannot access safe abortion, then what happens? The negative masculinity takes advantage. So let's give an opportunity to young men, empower them, and boys, and I'm sure we can address inequality. Thank you.
Thank you. Thanks, Patrick, and on to Cassandra.
Hi, I'm Cassandra, and I work here in Ottawa with the Healthbridge Foundation of Canada. I've been hearing a lot lately and thinking a lot about this concept of, especially within feminism, of claiming the space. So there really is this need for women to claim our place within public life, within political life, and that's, for centuries we've had to do that. But there's one place where really we don't have to fight to belong, and that's within feminism itself. It's sort of like we naturally fit. However, the reason why we don't have to fight for a seat at that table is because that's a table that is being shared with so few men. And that's really a problem because, in order to address gender inequality, we need to have men involved and boys involved so that they understand that gender inequality is something that negatively affects society as a whole, and that, patriarchy is a system that systematically benefits males over females, but that there are also gender norms that are incredibly harmful for young boys and for men as well. So, I was told that this is very solutions-based and to talk about what I work on. So I work for the Healthbridge Foundation of Canada on an MNCH project in Nepal and Vietnam. So we work, throughout our work, we really emphasize male engagement in MNCH and tackling gender inequality and improving maternal health. However, in our approach to doing this, we really emphasize that we don't just want men involved in a way that could potentially exploit gender inequality or reinforce unequal power dynamics or reinforce men's position as decision makers within households. So this is the tricky part, because although we want women to access maternal health services, to access antenatal care, we don't want to engage men in a way or have them involved in a way that they just dictate that that's what their wives need to do. That's not what male engagement is about. So we have to be really careful and really focus on having a gender transformative approach. So we really encourage dialogue and joint decision making, and have men understand why maternal health issues are important and why gender inequality is something that's so important to everyone. So something that we are doing that I can share with you, and there are pictures, I don't know if they're being shown. But we are working with youth groups and child clubs in rural, remote areas of Nepal. And so we've conducted, with our local partners, we've conducted these workshops to work with young youth and share information about maternal health and gender inequality. And then, those aren't the pictures. That's okay. So we've worked with them and conducted these workshops. And then going forward, we really have provided them with a platform of what they can do next within their communities and how that they can move forward. So they've conducted these skits. They're called street dramas. So we've allowed them to, or encouraged them and supported them to develop together these skits that they then perform in their communities. And, you know, what's marvelous about it is there's so many people from within their communities come out to watch. So there's been hundreds, actually thousands, who've come out to watch these communities. And what we've seen is that, and what's so remarkable about it is that you have young children and you have adults, but you also have males and females that are coming out to watch these street dramas that are addressing maternal health, gender inequality issues that are facing their communities. And these are dramas that are written and performed by male and female adolescents that have worked together to develop this. So just in closing, I wanted to say that we really need to engage with males to address gender inequality, and we need men to have a seat at the table, but it's really important that we don't just give men the head of the table, because we need to engage men, but what we don't need is another male-dominated space. And that's not what it's about. It's about working and engaging with men and young boys to work together, because gender inequality is something that affects everyone, so the solution has to be one where all genders work together and collaboratively. Thank you.
Thanks, Cassandra. And our final opening statement, Joanna's.
So thank you so much. I'm Joanna Paulus. I'm originally from Cameroon and I live in Toronto. And I'm a Women Deliver Young leader, as well as a member of the Speakers Bureau for the Aga Khan Foundation, Canada. And growing up as a child, I got to hear some of the experiences of women and girls, and especially widows, and one of them being my mom, and the challenges that she went through being a widow. And let's understand that most widows in a typical African setting, are often discriminated, abused, and exploited. And for example, if your husband dies, what happens is you are being accused of witchcraft, or you're accused of murdering your husband, or and that entails having you to go through some cleansing. Also, it requires, also the woman is completely disinherited of the property, so you can't own any of your husband's property. And also the fact that sometimes you're being forced to remarry, maybe a brother to the late husband, or a member of the family. And if you say no, sometimes you're sent out of the house. And also the fact that, and the problem with getting remarrying is the problem of HIV, AIDS, that can be transmitted in that process. And the fact that child bride is a huge problem in my country. Among the countries with the highest prevalence of child brides, Cameroon ranks 20th. 1 in 3 girls are married before the age 18, and sometimes as early as 15. In Niger, 89% of the girls would marry before their 15th birthday. And also the fact that we have a practice called breast ironing. I know maybe you guys are not aware, but breast ironing is a practice where the mother takes a stone or a spatula and put it on fire to warm it up. and massage the breast of the girl just so that the breasts don't develop. Because if the breast were to develop, it's going to attract men. And when that happens, the woman doesn't want the daughter to get pregnant because it's another problem. And so, some of these issues, when I was working with these communities, I was like, so how do we solve them? And I came to realize that we were doing more of talking than listening. And in the process of listening, I came to realize that communication was a big problem. And in a typical African setting, communication is pretty much done between the kids. So the mother is sending the kid, go give your dad food. The dad is sending the kid, go tell your mother this. So there is never that dialogue. They never come together. That's just the case. They never meet. So I was like, so how do we address some of these things? So we thought, okay, creating a safe space where men, women, kids come together, share some of their experiences, challenges, their perspective, and we ask them why such practices. And we realized that most of these men, they just, they felt ashamed, and, most of the fact that the women were not educated, and coupled with the fact that these men, they didn't have an answer. They just kept on the practice because, that's how they were brought up. And we came to realize that communication was very vital. And what we did was, when we brought them together, we asked them questions, they told us their stories, and we also realized that after that, the mentality, the perspectives of the men changed. What happened was more men were sending their daughters to school. Child marriage, was gradual. And we came to realize that listening is a very critical thing when we are doing intelligent development work, especially when it concerns very cultural sensitive issues. So those pictures are some of the pictures that I took in Niger, where I meet some of the men and we talk about, some of the issues they face. And then also, so we engage them to empower them. Yeah, thank you.
Thanks. Thanks, Joanna. Great opening statements by all of our panelists. If you folks are wondering why I'm jumping around in my chair here, I see only 16 minutes and 45 seconds on the clock. Can that be right, or? That is right, okay, because we've got a hard stop after this, but let's launch into some of our questions then. And Joanna, you were just getting warmed up, so let's continue with you. And the first question is, some of you have been attacked and condemned by your peers, especially young men from your culture, for your passion in addressing girls and young women's issues. Can you expand on some of the challenges you have experienced in your work with men, especially when it comes to addressing some of the cultural stereotypes you mentioned? So Joanna, I'll start with you and then go to Patrick, and then we'll go on to the next question. And pretty short answers if you can, so we can get a number of questions in.
So let's understand that a culture in a typical African setting, it's static, it's not dynamic. Changing these norms, it's so hard. And working with these men, I came to realize that insofar as they were not educated, they wanted change. They wanted to change some of these practices. But there is no space. They don't know how to start. They don't know where to go to. They don't know how to approach some of these practices. And some of the challenges that we face, is the fact that to them it's just a story. It's like you're preaching to the same people. And one thing that we did was, we used stories of kids of successful men, who are now in universities working and sending money back to their families. And we asked them, is that what you want for your daughter? Is that what you want for your son? And they said yes. And to them, using those stories and using that perspective kind of changed some of their thoughts and perspective when it comes to
Patrick, over to you for a nice, crisp answer.
Yeah, again, like I earlier said, you see, our lives begin to perish the day we keep quiet about things that matter. And yes, oftentimes, like my peers, my uncles, my teachers, like have questioned why, but why do you speak about women's rights? Why do you speak about girls' rights? Why all the time? Even on social media, like people are really concerned and they are bombarding you with many questions. But you see, again, it goes back to lack of knowledge. People, even those who expect that at times they know, even those people are men of responsibility that at times you expect that they know, at times lack the information. Like I told you, society is very important. Values and norms are very important, especially like in Uganda where I come from. People's behavior are defined by culture, are defined by society, are defined by their norms. So in most cases, when they see you doing things that do not so much read back to culture, then they are concerned, they really want to know why. But again, it's important because you can, having undergone this whole kind of investment, trying to understand human rights, trying to understand, issues of human rights, sexual reproductive health and rights, gender, you don't want to really see injustice and keep quiet, because it's injustice. You want to do something. Having undergone through this and also helping people to know that, like GBV or inequality does not only affect the victim, it spreads to the family, to the community. You can imagine children that are born to a couple that where one of the partners, faces GBV, what they think, and how it affects them psychologically. Yeah.
Thanks for those great responses. We're going to ask a skill testing question of our Canadians on stage here. The last one was directed at our international panelists. Canada is often seen as progressive in addressing gender equality. How do you engage young boys and men on this issue? And if you particularly have some specific advice for the government and for the people gathered here.
So it's definitely, there's this notion that we're told, especially as young adolescents in Canada, that Canada is a progressive nation in terms of gender equality, which is true, and we have to be proud of the steps that we have taken, but we can't get stumped on the fact and on this notion that we're progressive, because we still have a lot of steps that we need to take in order to reach gender equality. And within our country particularly, these steps that need to be taken often should be engaging men to be able to fast track those. Like I was saying, we need to encourage men to be able to recognize their privilege and share the space, like Cassandra was also touching on. Sharing the space is something incredibly important in a country like Canada. And also, like Patrick was saying, a lot of it comes down to education. So Plan International Canada has a threefold step process that they use specifically with MNCH programs internationally, but that also can be applied here in Canada. So it's to educate proactive male partners, to engage them, and then to maintain the enabling environment. But in Canada, we get stumped on the education part, because as we grow up, we're socialized around these gender roles and around this notion that we're progressive and that these issues aren't issues for men to be worried about, when indeed they are issues that men need to care about and that men need to do something about. Just a few anecdotal points in my personal experiences. As I was growing up, things like sexual education classes are segregated by gender. We're not taught things about the female reproductive system and the issues that they face. So we're grown up, socialized around these gender roles, and that's not our problem. Things like maternity care and paternity care. When we think of a newborn child, it's always the mother taking up to a year off, sometimes more. The father has paternity care, but it's often not nearly as long, if it even exists. So again, the children are being brought up, socialized to these notions that their mothers need to be partaking in these gender roles of motherhood. And I just saw something yesterday in my home province of New Brunswick. Our Provincial Hockey Association is contemplating forcing female hockey players to play strictly with a female league and not allow co-ed hockey teams. And again, this will cause the younger people in our country to be brought up thinking that men and women can't play sports together, again, reinforcing gender roles. So there's all these things that tie back to education. And the more education we get in a country like Canada, the more equal partners we'll have.
Cassandra. Oh, you can applaud. That's okay. Cassandra?
So I just want to share something that happened earlier today. I was on Twitter and I shared a quote from Minister Bibeau's speech this morning. It was great. Some of you retweeted it. Thank you. But there was a comment, and I think it just really illustrated why we still need, in a country like Canada, why we still have so much work to do. So the quote from Minister Bibeau was about how adolescent girls, they need to have a voice and a choice, and that included safe abortion. And the response was that we should support responsible behavior and emotional control. So yeah, that's good. That's exactly, reproductive rights don't matter. Just control your emotions, ladies. And unfortunately, that's the attitude that a lot of people have within this country, and that's what we really need to fight against. And the person who tweeted it, their handle was Nova Scotia Voice, and I'm from Nova Scotia, and they don't speak for me, and they don't speak for a lot of us, and they don't speak for a lot of us in this room and in Canada, and I think that we need to counter that voice, because it's easy to take for granted that the rights that we do have, but we really need to stand up and fight to keep those rights and to go further, because there's still so much work to do, and that's why we need to recruit adolescent males and females to keep on the good fight, because there's other forces that are recruiting them to take on issues in a regressive way.
Great. Thanks, Cassandra. Folks, I had a few more questions on my list, but we're down to 8 minutes and change, and I think what we'll do is go to the audience to see what questions you might have. I don't know if there's a roving mic. You might just have to stand up and yell. Is there a roving mic? There is. So if you just put up your hand and perhaps identify yourself and who you would like the question directed to.
Hi, I'm Dara. I work for Action Canada for Sexual Health and Rights. And thank you all for your interventions. I wanted to say that I am worried about the creation of a category called positive masculinity. I agree that such a thing as toxic masculinity exists, and I worry about the creation of positive masculinity in order to separate men into two categories of good and bad, when really toxic masculinity is something that affects all men and is a creation of gender stereotypes and enforced gender roles, which all men, feminist and not, are victims of. I also worry about the notion that, or it's not, of course it's true that men are affected negatively by patriarchy, we all are as a society, but we also have to remember that patriarchy privileges men and oppresses women systemically. And so to say that men and women have just as much stake in ending patriarchy, women are going to be the victims of patriarchy, where men will be systemically privileged by patriarchy. Yeah.
So can we get a comment on that? That's great. Who'd like to take that? Cassandra, you look like you're just chomping at the bit there. Yeah.
Yeah, I completely relate to that feeling, and I think it's a really tricky thing to address, because the problem is we do need to have adolescent males that are engaged and that recognize patriarchy and that they recognize their own privilege, but there is definitely this idea that it's hashtag not all men. Feminism isn't about men per se. It's about the system of patriarchy, and so I understand of talking about toxic masculinities and positive masculinities, that it does sort of make it seem like there's two different camps, when it's not necessarily that there's two different camps, but that it's this whole system that we need to challenge and break down. Yeah.
And over to the microphone on that side of the room. And folks, if I could ask you to keep your questions pretty short and to the point so we can get quite a few in. Thanks so much.
Hi, thank you to the panel. I love this subject. I think it's absolutely fascinating. What always interests me about masculinity, though, is that there are toxic aspects of masculinity that affect men as well. When you look at their health-seeking behavior, for example, and their vulnerability to certain diseases and then not getting timely treatment, which then also impacts women. Because if men are sick, and in some African countries, well, in many of the societies, what happens is the man becomes sick. He's often the main income earner for the household. The woman then has to take that over and she feels the impact also of caring for who is ill. So I always find that aspect we don't always necessarily talk about, but there is an impact on men as well.
So will any of our African friends would like to?
I do think that's a very, very important point. And also to mention that, I think it's actually time to have men realize that we have a role to play. All of us here in this room are feminists, but it depends how you interpret it. And I think, if 50% of the world are left out of the conversation, I think we are living in a world on its own, and it's time to challenge some of the norms, some of the cultural challenges that we, the men, we perpetuate back in our communities. And it's working, but I just feel like there are just very few of us doing this, and I think it's time to do something about it.
Patrick.
Well, I actually didn't hear the question well, so I can't comment about it. Sorry.
We have another question anyway, so.
Okay.
Hi, I want to thank you all for coming and for, for your concerns and for the work that you are doing for women. I do appreciate men joining the conversation. I guess my concern is about representation. So I know that you, Cassandra, you had spoken about feminism being an equal space for women. I'm not sure that feminism necessarily is equal for all women. So trans women, women of color, there is a lack of representation there. And then also, I would like you to speak a little bit more on how you manage representation when men are involved. So how you ensure that they don't take a dominant role. So like for now, just like kind of looking at this panel, just in terms of like your body language, like not to put you guys on the spot, like, but the men are all kind of sprawled out. They're taking a lot of space. You're kind of, on the side of the chair.
Honestly, I have run with a pantyhose, so I'm trying to hide it.
Fair enough, but I do think that it's a good kind of image of what it's like to have a conversation with men where we do kind of take a back seat. So it is a concern of mine. I think that it is important to have men join the conversation, but it is a concern of mine of how we can do that in a way where women are still at the forefront.
Okay, we'll go to Patrick, Austin, and then why don't we give the last word to you, Cassandra?
Yeah. Well, if I got you well, I think gender inequality, addressing violence and all that, to me, I feel like the discussion and the dialogue needs to be both ways. Like, gender inequality can't only be a women's issue, neither can it only be a men's issue. Like, it has to be both ways. But knowing that, again, like I said, society, there's a way it positions men, and also the kind of like patriarchal kind of, society that we live in. So that is why we really need to target men, especially when they're still boys, and adolescents. And also, support young men and adolescents to understand, initiatives like, for example, the She Decides initiatives, to be able to learn about the rights of, the reproductive rights of women and girls at a much earlier age, and be able to engage in dialogue and discussion from a very informed point of view. Yeah.
Austin and then Cassandra.
Speak on that just quickly. It's definitely, Cassandra and I had this conversation literally 20 minutes before the panel started, and we were discussing the same issue. Now the thing is, we were sort of going over it, and the way that I see it as a Canadian adolescent on this panel, these questions are extremely important, and we need to keep asking them. But the problem is that we've been asking them, and we've been asking them because men in Canada in particular, speaking from personal experience, think that it's not part of their problem, not part of their issue. So we need to get over that in order to eventually be able to start reaching the answers to those questions. But the first step to do that is to be able to, like you said, get men to be able to share the space, get over the gender roles, that all men, regardless of if they believe in gender equality and are striving for it or not, are susceptible to. And get over those and be able to reach these equal partners to work together. And then that shared space coming from men recognizing their privilege will eventually start finding the answers to those questions. So I encourage you to keep asking those questions until we finally get an answer.
Cassandra, last word to you, and then we'll have to close.
Okay. Thank you so much for your question. I really appreciate that, especially the part about feminism being inclusive and intersectional. And I completely appreciate. I had a bit about that in my speech, but I got cut for time, unfortunately. So thank you for bringing it up. And I think it sort of runs along the same lines of, you know, as a movement of being inclusive and being accessible. So, you know, I struggle with the, like, we need to bring men involved. I think we need to be inclusive so that men feel that they can become involved. And I think, you know, feminism, you know, so that it isn't just, you know, like cisgendered Western women who identify as being feminists, right? It's about being inclusive and being accessible so that, you know, other voices can be heard within that. So I guess that would be my answer, is that, you know, addressing this needs to be inclusive and also accessible, you know, opening up to men as well as different genders, different ethnicities, and just have lots of different voices at the table.
Well, thanks, Cassandra. Thanks to all of our panelists for your insights, your energy. I know I've been inspired by what you've had to say in front of all of us, and I've learned a lot that I think I'm going to be able to apply to my work, working with the Status of Women Minister. And folks, can we put our hands together for these inspiring young leaders? And may I just say finally that I think the movement is in very capable hands under your leadership. Thanks so much. And thank you for listening this afternoon. Thanks so much.